Commonwealth Club of California. Thank you for being here today, whether you're here in person or watching or listening online. I'm John Zipper, the club's Vice President of Media and Editorial. Thank you for being here. Thank you for joining us. Our program today is presented in partnership with GAPA Theater, The Connection at the San Francisco Community Health Center, and the San Francisco AIDS Foundation. And this project was made possible with support from California Humanities, nonprofit partner of the National Endowment for the Humanities. Now it's my pleasure to introduce Michelle Meow, the producer and host, of course, of the Michelle Meow Show, and our host for today, as well as a member of the Commonwealth Club's Board of Governors. Michelle, good to see you again.
Thank you. Thank you so much. Thanks again, everyone, for joining us for lessons we've learned from pandemics, the HIV/AIDS crisis, and now COVID-19. And so our incredible panel here today of activists, advocates, community members, your neighbors, your friends, your family members, we're all here to discuss what we learned. Our speakers today, Ignatius Bao, who's the former HIV prevention program coordinator for the Asian and Pacific Islander American Health Forum, also former member of the President's Advisory Council on HIV/AIDS. We have Cecilia Chung, who's a Senior Director of Strategic Initiatives and Evaluation for the Transgender Law Center, and who's also a Health Commissioner for San Francisco. And last but not least, Vince Crisostomo, who's the Director of Aging Services for the San Francisco AIDS Foundation. Let's give a warm round of applause, if you're here in person and online, for our speakers. I'll start by sharing, what I felt, what I remember when COVID-19 became something that I should be aware about. And it was February of last year, right? Was it last year? It
2020.
feels all like a blur. But my wife was actually in Thailand visiting her family. And so I was following news from Asia constantly just to keep up. And so when it was reported, in my mind, I was worried about it. I was alarmed by it. But maybe it was my American exceptionalism or perhaps arrogance or whatever it was. In the back of my mind, I told myself, well, it's not going to make its way here to the United States. Right. And so let's start by having our speakers share, your moment. And maybe even as naive as I was, you may have recalled that for yourself when you heard of HIV/AIDS for the very first time. We'll start with Vince.
Well, I was actually in Japan. I was teaching aerobics. It was during the era of flash dance. And my boyfriend at the time showed up with the English language newspaper and said that there's this disease killing gay people, and we think all Americans have it. And he asked me if I had it. And I'm like, no, I don't have it. And I think you need to leave now. And I didn't think anything about it. And then I returned to the U.S., and a friend of mine who lived in San Francisco was telling our friends in Hawaii that he had this gay cancer, that he wasn't expected to live. And then later that year, I moved to San Francisco, and it was not the San Francisco that would have been summer of 1984 that I had come out in 1979.
Thank you. Ignatius.
So I came late to my own awareness, even though I was here in San Francisco. I was working as an immigration and civil rights attorney. And I think the moment for me was, as an attorney going to a first training, volunteer attorneys to be able to help people with HIV and AIDS at that time do things like their last wills and testaments. And as I sat there through that training, I realized this is going to change my life, as I was still struggling to come out. And I knew that as a gay man that this was going to have an impact on me. I didn't know how and when, but that, I think, moment for me of sitting in that training and probably in 1987 and realizing this is going to be a huge part of my life and the life of my community.
Mm-hmm. And Cecilia?
I must say I was pretty oblivious, in the beginning, because I moved to the United States in 1984, at the end of 1984. And And it's not like there were a lot of discussions about HIV, like in my community circles, and especially, not among my Asian friends. Part of it is because, it's being labeled as, a mysterious disease that was impacting the gay community. That's how it was first reported, and then it was gay cancer, and then it was gay-related immune. GRID, GRID was the last one before, they start labeling it HIV and AIDS. And so for me, I think, at the time, I ended up contributing to some of the misinformations because there were no stories about Asians or Pacific Islanders who had tested positive for HIV. All we knew was it was like sweeping the entire gay communities, and it. You can see that, if you were going to a club, in San Francisco at that time, most of the places were half empty, when, normally it should be really festive and buzzing. So, something was going on, but you just don't know. Well, I knew something was going on. I just didn't know how much of an impact. And I think that the first time I ever recognized the real impact of it was when I saw the quilt.
Michelle,
Yeah.
one of the things that I also remember, based on what Cecilia said, is that at least in New York, there's a rumor that Asians didn't get it. So when I went to get my test, I thought it's not going to matter because I'm not going to have it. And so I just left, and I didn't even go back to get my results. And then I was getting into a taxi on the corner of 72nd and Broadway in New York, and I got this chill. And I thought, ooh, something's going to happen. And so that night I went home, and there was a card in the mail that said, please come back to the clinic. We need to talk to you about your test. So that was April of 1989. So, and the result came back positive.
Vince, I think that, you touch on my second question, or my next question, which is that moment where it feels real. It took me a few months after even the country went to lockdown for COVID-19 to finally feel like this is a real thing. And I was sitting on this very chair and doing a program. We were still doing virtual programs just like this, I think wearing face shields. And on my iPad, I started getting these notifications come in, and they're from St. Mary's or St. Joseph's Hospital. And I couldn't turn the notifications off. And so as I'm on the air, I get a notification that a family member had passed. When did it become real for you? We'll begin with Cecilia.
So it's a hard question to answer, because the first time that I started to think that it would impact me was when I saw the quilt for the first time in San Francisco. And then later on, because at the time I just came out as trans, and I was impacted by everything associated with being trans. So I lost my jobs, I lost my support from my family, and I ended up being homeless on the street of San Francisco in the Tenderloin. And I had to rely on survival sex work, to survive. And also at the same time, I was self-medicating. So I was pretty sure, that eventually it will all catch up, that I would get tested HIV positive. But the first time when I was tested, I was in the emergency room of CPMC, and the result came back negative. Actually, at that time, I thought, oh, something's wrong. The test was wrong. Why wouldn't I be positive? Because I was also sharing needles at the time. And then a year later, lo and behold, I get tested again, this time at the it's at the Mission Neighborhood Health Center on 16th Street, and the result came back positive. And I remember that I was in total shock. Like one of our friends, a friend of Ignatius and Vince and mine, Dominic, like sat with me at the new Yobe Buena garden. They just opened it. I remember sitting by the fountain and really going through all these rationale and say, oh, at least I'm not going to die tomorrow. I will have enough time to straighten out my affair. And that's all I could think about. For a long time. That I was going to die in a year. So like, what the hell?
Ignatius.
So that's hard to follow Vince and Cecilia's story. So I think it really became real for me at my first funeral for someone that I knew who passed. And I think the fact that, all the gay friends sat at one side of the service and all the family members sat on the other side. And I remember as we left, they, gave us pamphlets to tell us that we were going to go to hell because we were gay. And that lack of support, that division, even at that moment of grief, I think also then made me realize in a very emotional way how much this was not just an individual issue, but an issue for our families and our communities. As Cecilia had said, up to that point, there was this perception that Asians and Pacific Islanders were immune or somehow weren't going to be impacted. And it was clear that those impacts were going to be in our families and in our communities.
When I first met Ignatius, I was like, we need you. And he's like, and I said, you need to say this at this meeting. And he's like, why do I need to say it? And I said, because you're a lawyer. They'll listen to you. You have credibility. The rest of us are like artists, waiters, bus boys. It's like I thought, God, this is really serious. I didn't think we had a strong skill set. But then I learned, never underestimate people. Never underestimate that a handful of committed individuals cannot accomplish some really great things. But I just remembered, we need to bring Ignatius. We need credibility.
And that's also,
and
go
I would
ahead,
say,
Ignatius.
and I would say that we had a lot of allies. So this is also the moment of the LGBT Asian community also finding its voice and identity here in San Francisco. Again, that we take that for granted right now, but it was really hard for those first elected officials who were straight, who stood with us. And so judges like Lillian Singh and Julie Tang, and elected officials like Mabel Tang, who came and supported us, embraced us as people and welcomed us and put their credibility on the line to speak up against homophobia, and to advocate for more funding and services and programs for people with HIV and AIDS.
And also
Go
a
ahead,
wake up call for us, I think, like that, because Asians, we are the model minorities and we don't really talk about sex openly, let alone like giving lessons on how to put a condom on. So, these are all new for us at the time. And thank God for Vince, and his Love Like This theater, like that really, make it easier to lighten up some of these conversations.
I'm going to go off script just because we already have brought up this point, but with AIDS, HIV, the LGBTQ community was discriminated against. Many people had created the narrative that it affected the LGBTQ community. So if you were not LGBTQ, it wouldn't affect you. Or in some cases, if you're AAPI, you won't get it. In this case, in COVID-19, however, if you're Asian, you have it in some sense. And I know that that's a heavy statement to make, but being LGBTQ and AAPI, having survived AIDS, HIV, and then living through COVID-19, you're both. What can you say or share with us, the your thoughts, the impact of surviving both pandemics and both identities being targeted for violence, hate, being the scapegoat, being the blame. We'll start with Vince.
I had a feeling you were going to start with me. Well, there were a few things. First, when we started hearing about COVID, and we were already hearing things coming out of the Oval Office. I don't know how I'm supposed to say, but I thought, oh, this is not good. This is not good. And crossed my fingers. I said, if this, and I remember we went in shelter in place, I think on March either 16th or 17th of 2020. And I remember going to the grocery store, or I had to go to Kaiser actually, and I think they canceled my appointment. And so I was walking to the Target over on Geary, and I was wearing a mask, and I heard these two guys were walking toward me, and they started saying just racially, and I thought, okay, and I kept walking, and I went to Target, then I went to Lucky's, and I was going down the frozen food section, and this woman came back, and she went like this and pushed herself up against the wall. And then the last thing I did was I went to a market in the Haight Street, and they made me stand outside, and it was raining, and I realized they were letting other people go in, and I finally said, hey, why? And they let me in, and then I realized what was happening. And I just crumbled. Like all those years of living what we lived through, and I thought, I can't do this again. I just cannot do this again. It's not fair, and I just really, like all the strength, that we cultivate, it just started to crumble. And, but then I was lucky. I was doing all these lotteries to buy a house, and my loan agent said, Vince, snap out of it. No, he didn't say it like that. He's like, Vince, in times like this, you need to make choices that are optimistic. Optimism brings hope. Where do you want to be? If there's anything your life has taught you, at one point this will end, where do you want to be? And so I just started to use this as a time to reframe my life, look at what we didn't get right the first time, and just to kind of redo that. I don't know if I answered your question, but
Yes.
it's still something that's in process.
Right.
And I feel that if ever there was a reason to have survived the AIDS epidemic, it's been COVID, so that we can show and we can tell people this is what happened the first time around, don't let it happen again.
Mm-hmm. I really felt that last statement as much as I wanted to crawl under a rock throughout this year and a half. Ignatius.
So, unfortunately, and even more so today, we respond to what's going on out of fear rather than out of love. And I think one of the things that we learned through HIV and AIDS, and are learning the hard way again through this pandemic of COVID, is that if we allow that fear to be what drives us, and that's what creates the stigma. So again, it wasn't just against LGBTQ people, but it was, at one point it was hemophiliacs and Haitians and homosexuals. And so there was the stigma against those populations as well. And I think that has turned to the anti-Asian hate and bias that we've seen in our communities that Vince just shared about. And again, I think the lessons, just as we all came together around HIV and AIDS, across races, across gender identities, across sexual orientation, across different ways of being in the world, that we realized that we had to come together to come up with the response that we needed. And I think today we're learning what it means to be essential workers and the luxury of being able to work from home versus having to go to work and physically be exposed. What it means to have housing, to have food as basic necessities. It's not just about healthcare, it's about how we live our lives. And so I think those lessons are going to be important to carry forward, and hopefully policymakers and those who have more power and influence can put real solutions behind addressing those underlying causes and issues.
And Cecilia.
I think that I have a little bit of a different take on this, and I really appreciate what Ignatius just says, because we did learn, even from the HIV epidemic that, the social support system is crucial, for the survival of those living with HIV. And I think that here it's working in very similar way. The difference back then was that the leadership in Washington, D.C. didn't acknowledge, the impact of HIV for years and years. And the leadership, when the onset of COVID started scapegoating the Asian community, especially Chinese community. And, and I think that those are really the power of these leadership. And they, they actually, I need to say that I would hold them accountable, for the harm that both epidemics have done to different communities. The difference this time is that I think we organize faster. We also have more allies, in the cause, and so scientists stepped up and say that this should not be called a Chinese what's that term? The Chinese virus or the Wuhan virus, there should be a specific name, the scientific name for it. And I think that that's really important because last time, when we have HIV, they start calling it grit. And guess what? It just worsened the kind of stigma and discriminations that the community faced. So I think that that's number one, the difference. And number two is because of the widespread impact of COVID, I think that it was really hard for Congress to ignore. For the HIV, it wasn't until a boy named Ryan White spoke in front of the public, in front of a camera, that he caught HIV from, a blood transfusions, that it became a national issue. That the leadership in DC start to look at how to create resources for that. Look at COVID. It didn't take long for them to send out the first stimulus check, to everybody because they knew the impact. Had that happened back in the days, it might have already prevented more death, because they would have the nutrition necessary to fight off some of the opportunistic infection. So call me bitter, but I think that I just need to call spade a spade.
Mm. Oh, how can we not be bitter? Go ahead, Vince.
One thing a point that needs to be made is that now, more than any time in history in this country, it's time for people to get up and speak their truth. Because otherwise, history will be written in a way that doesn't hold those accountable. Because this was a leadership issue. COVID has killed more people, or at least the same amount of people, in 18 months that it's taken HIV 40 years to do. And that's a huge difference. And the fact that if you look at how leadership responded to this, you look at what was said, and at what point in our history in this country have we ever not paid attention to the experts? And yet here, to placate certain people just turned a blind eye. And I hold people accountable because, people, I remember, I was a performer. I remember people like, oh, I don't want to play a gay character because it might hurt my career. I'm like, your career, who knows you now, And it's like, you placate these people or you cater to this sort of leadership, and what? 700,000 people in this country died? And it's like when we have elections, I'm probably going to get in trouble for saying this, but we're supposed to be neutral. I'm like, how can you be neutral? We lived through this. If anybody isn't going to speak up about this, if anybody should speak about it, it should be us.
Mm-hmm. Ignatius, would love for you to add also on failed leadership or how leadership can affect or impact our communities during pandemics, as you have served on an advisory council to a president, not the previous. Go ahead.
So So certainly we have to hold those leaders accountable, but I have long stopped looking to those sort of official leaders for what I consider leadership. I think leadership comes from our communities. And just as HIV and AIDS also created leaders like Vince and Cecilia, who went on and did work globally to lend their experience and expertise to fighting the epidemic of HIV and AIDS across the world, I think this was also a coming of age for many of us. Vince jokes that, I was a lawyer and so supposedly could talk better than others, but we created a whole generation of leaders, of organizations, of movements, because we had to, because there was nobody else for us to look to. And so I think we had to learn those skills to support each other, be mentors and role models for each other. And I think we're seeing that today. I have to point out, for so long, we lumped together Asian Americans and Pacific Islanders, and the impact of COVID-19 has been so much disproportionately on Pacific Islanders and Native Hawaiians. And many people still don't know that in, over a dozen states, the number one population that's been impacted have been Pacific Islanders. And so we're seeing now this resurgence of leadership of Pacific Islanders in Pacific Islander organizations that we've never seen before. And again, we should embrace that. We should support that. We should continue to elevate that. It's their moment, unfortunately, because of this crisis, that they are being called to that leadership.
Thank you. Let's go back to Vince and Cecilia and your global work. It's interesting with COVID-19 that, borders started shutting down, but also like this narrative that we had to confine whatever data that we're collecting would be to a certain country, certain region, or all of a sudden it almost felt like, everybody became a little bit secretive. And that's my generalization, by the way, my opinion. Like, it was hard to get the information. But there's a lot of things that we could blame that on: social media, the president, whatever. But go back to your global work and talk about, doing the work and the responses and how effective you became in other communities because of your work. We'll start with Vince.
Well, I left San Francisco in 2000 and I went to Guam, which is where I'm from. And I was the executive director of the first community-based organization who was funded to do HIV work. And from that, I met a lot of international people, the global networks. And so in 2007, I joined something called the Seven Sisters, which was a coalition of regional networks. And I had this opportunity to do some policy work with UNAIDS. And I thought, oh my God, all these things that never made any sense to me in San Francisco in the beginning suddenly made sense. And so it went from there, so we need to legalize punitive drug laws. Sex work is work. Trans people need their own spaces to organize and mobilize and be respected. Being from academia is not the same as being from the populations, and our expertise is just as valid as your expertise. So I got to facilitate all these questions. I think the first person I tangled with at the UN was a former CDC director. And he cited San Francisco, and I'm like, how dare you stand in front of us and cite San Francisco in front of people who don't have those, and I don't know, and I think they said I was never going to be invited to another meeting again. But lo and behold, not only was I invited to the meetings, I got on their board. And from that, we did things like Getting to Zero. I was the first non-government person to speak at a high-level meeting in Asia. And they got it all in the, a report. I didn't think anything about it at the time, but it actually had some repercussions. And then it also says, God, it takes 10 to 15 years for policy to trickle out into the world. I'm going to be 80 before I see any results from what I'm doing now. But it was pretty amazing. But, what I learned throughout all of this is there's the work, but it's really the people. And if you can get people to care about their lives, then you're really doing something. Because I think one of the things that really hurt me here in San Francisco was our clients at API Wellness Center often refer to them as disposable, themselves as disposable, discardable. And I said, we need to change that. I'll let these two talk, because...
Cecilia.
Well, interesting. And then in 2008, I saw Vince at Mexico City at the International AIDS Conference. I said, "Oh, you're here!" And that's actually how we reconnected. I don't know if you remember.
I
Vince.
do remember. I
Yeah.
remember this is progress.
And it was also, during the conference when we had, the pre-conference, for people living with HIV, across the globe to come together and really develop, our policy agendas and recommendations that, all these discussions about decriminalizations and access to care pops back up. And I think that I got a lot of education from being in that room with women from the global south, in sub-Saharan Africa, who were so used to being harmed by men, number one, and also of all the misinformations that they have about how to cure HIV. And so they saw criminalization is the last resort. And we were able to have conversations, about, what actually caused that, and really go back to the fundamentals. And, that's how some of the conversations started to shift. And we started to look at stigma and what stigma is. And, and the next thing was the creations of the HIV Stigma Index. I was privileged enough to be representing U.S., on the global GNP, Global Network of People Living with HIV, and be the chair of it. So, and see the harm our country, United States of America, have done to other countries, and we had seen, in the global picture that how, people were being harmed under the guise of religion. We saw, people being scapegoated, under HIV criminalization laws. You don't even have to have, evidence, to be blamed. And also, we see homophobia being fueled by HIV as well, even though that it might have nothing to do with the individual, that the individual might not even be gay or anything, but they get attacked a lot, and it's just really eye-opening and disheartening to see that. Of course, when we talk about homophobia, the most visible, LGBT folks, are transgender women, globally, and so. Guess what? When people talk about anti-gay, they're actually also talking about anti-trans violence because they are the one that, took the fall. So I think that there are so many things, in play here, and it is up to us, those who are supposed to be providing resources, to the underserved countries, to combat all these different epidemics. And yet, at the same time, when there is vaccine and when there is treatment, guess who are the last one to get it? Mm-hmm. Those countries. Mm-hmm. And to me, I think that it's not fair. Equity needs to be. We need to practice equity across the globe to make sure that low-income countries get most of the resources first. And I think that, those are conversations that is going to take a while to happen. And at least, Vince is optimistic enough that by the time he's 80, he will see things change. And I'm not that optimistic. I don't think that I would see the cure of HIV in my lifetime because of these kind of political tug of war that we're going through, that totally dismiss, the needs of the people that they're supposed to represent.
Mm-hmm.
There was a conversation that I witnessed. I can't remember if it was the UN or the Global Fund, but they were activists from the developed country talking about the medication that was available to the developing countries, and they were calling it crap and shit and da-da-da and whatever. And there was an activist from Nepal who I believe is still alive. He said, but this shit is keeping me and my country people alive. You really need to think, you pointed at the developed, you need to think about what you say in front of us because we don't have what you have. And when you cast judgment on what we have, you're casting judgment on us. I thought, whoa, I need to really take this in because, and so I've always tried to be mindful about that when I'm having conversations, like who am I talking to, who is the audience, and how can I do this in a way that doesn't take anything away from them.
Thank you so much for those. And we're starting to get some questions from our online audience, so I'll ask those to our speakers. And if you feel strongly or compelled to answer them, go ahead and answer them. And for those of you who are in person here, if you'd like to ask our speakers a question, there's a mic right there in this aisle, and just step up and ask your question when I call on you. So the first question from our online audience is, it took so long for medical reactions for HIV/AIDS to come out, but it took only a year for Operation Warp Speed to get us working vaccines for COVID. Could you talk a bit about how the LGBT world would be different today had they come up with effective medicines in the mid-1980s?
Well, I can jump in. In the program that I manage, we talk about this a lot. If this had happened sooner, how many of our friends would still be alive? Would we have experienced the traumas that we have? How would our lives be different? And what has come from that is that, but you know, if that hadn't have happened, they would have never come up with this. So I remember someone saying that, so people owe us and we have to collect. I'm like, well, that's one way to look at it. But yeah, I mean, if this country had responded as quickly to HIV, so we would have a completely different community, but then we might not have the same kind of victories that we've had that have meant so much over the course of time and history.
Anyone else?
And I'll just jump in and say, again, we owe to the activists in ACT UP and so many other groups of really changing the way that we did drug approvals in this country. And I think that has obviously had that impact in how we had to balance both the science and the data with the need for speed and getting something developed quickly. And it also shows, back to Cecilia's point, I was in the conversations with the National Institutes of Health of why we weren't producing women-controlled devices or protections. And again, it was that there was no funding for that coming from the federal government for that. And so why those priorities were there and who was driving those priorities. So again, I think what COVID has taught us is that if we have the right priorities, we can get things done. Mm-hmm. And so it's not a question of resources, it's a question of political will.
And I cannot agree more. I think that it's also kind of irony that, one of the first contributors, the scientists that contribute to like the treatment of HIV is an Asian, Dr. David Ho, but yet, Asian seems to be the last group that got acknowledged, and be visible in the epidemic. And I think that if we had the same kind of mechanism in place like we do today, HIV would have been, would have a very different picture. And I think that, letting it sit there for like 5 years really damaged not just people, but it also, created more harms, in addition to like what the epidemic itself caused, which is the stigma and, the unnecessary sufferings that, people living with HIV had. With that said, I think that, San Francisco is a very unique city because, this is also the city where Ward 86 was created, to like help with people living with HIV, and they're the first to have the AIDS ward, and they have learned so much from treating, people living with HIV. I think that those practices actually was what lead to the low death rate of COVID here in San Francisco specifically. Like we have a lower death rate comparing to the rest of the country, and and we are one of the first city that declare herd immunity compared to the rest of the country. I think that those are really great lessons we've learned from back then that we've been using, and I'm so proud to be San Francisco and continue to tell people that San Francisco is leading the way.
And the last piece of that is also, I know so many of my friends who signed up for the vaccine trials. And so again, we need folks to contribute to that science, contribute to that evidence. And again, I think many people in the LGBT community knew the importance of that and signed up and participated to get us to where we could have those vaccines.
Yeah.
There's so much strength and courage, from our traumas as queer people. And I always lead with the fact that that's magical. Like, we're saving the world. We really are. We're super sheroes and heroes. And the second question, do you think people are paying enough attention to HIV/AIDS veterans like yourselves during this time of COVID, or are people still trying to ignore such lessons and teachers?
Are we going to have another session after this? Because
About generation gap.
Go ahead, Cecilia.
I think that this is where like different generations have different memories of the impact of HIV, and I think that that's also very clear today. That because of like the differences in experience, people would approach this epidemic very differently. For some of us, who are old enough to remember all that had happened, like we're taking this very seriously. So you tell us to like be on lockdown, we go on lockdown, and you tell us to wear masks, we wear masks. We want to make sure that not just because we don't want to catch it, is to make sure that we don't pass it on. And I think that, that's the kind of difference, like we really need people to think about. It's not about catching the disease, it's about spreading the disease. If these like protocols will help to control the spreading of the disease, like why do we have to fight so hard? It's not about our own life that we're fighting for. We're fighting for, our family lives, our community's life, our neighbors' life, So I think that switching those conversations a little bit would help a lot.
I think aging in general in this country needs to be looked at and reviewed. But I think people, this is where being around for so long, it's like we advocated for this for the end of AIDS long before they called it that. I remember a goal was for AIDS organizations to go out of business. And so that's happening. And maybe not in the way that we thought, and now a lot of organizations are fighting for their survival as opposed to ours. But I think at the time, people also need to, I think it's 40 years of HIV. And so this is, it's a fairly young epidemic, and we're still, it's still growing. So the story's not completely written. But I don't think, it's a very delicate question because depending on who you speak to, but I think aging in general needs to be looked at and revisited. And what I still don't understand is why we don't have universal health care in this country. If anything, if HIV didn't show it, I think COVID actually proved it. And, but I think that's another panel probably. I'll leave it at that. I want Ignatius to say something.
And I think, Michelle, the way I would answer that is, all of us were involved with the early organizations here in San Francisco that were grounded in the LGBT community that responded to HIV and AIDS. And that eventually morphed into the Asian and Pacific Islander Wellness Center. And now the Wellness Center is the San Francisco Community Health Center that is providing full medical services, trans health services. So it's also progressed in that. Yes, it continues its focus on HIV and AIDS, but it's gone beyond to really meet the holistic needs of the community. And I think that's actually progress that we should celebrate, that we don't, again, have to be just exclusively focus on HIV and AIDS. We can take a whole person approach to health.
Mm-hmm. I'm going to save one of our audience questions for last because I think it's a great last question. But we have a few minutes, so I'm going to continue on here with a couple of my own questions, and we touched on the health systems, and I'm curious to know your thoughts or feelings or stories that you might share with the differences of when we're dealing with the HIV/AIDS crisis and the impact on the health systems then, and then the impact that COVID-19 had on our health systems today. For someone like myself, realizing that our health systems are incredibly fragile and in this vulnerable state was like a wake-up call. Like, I was so shocked and surprised that we were mobilizing our communities to feed our frontline workers. They did not have enough, PPE, or people were sewing masks or giving away masks, and things like that. And so if you could share a bit, about what you saw as far as the health systems then, like, has much changed today? Are we still where we were at with, our infrastructure? I'm going to turn to Ignatius first, just because I know you do a whole lot of data collection around that.
So again, epidemics and crises show both the strengths and weaknesses. And again, our system of healthcare in the United States is so fragmented. As Vince said, we don't have universal access. There's so much disparities in how people can access or not access healthcare. And I also think it also became really clear that while it was so important for there to be hospitals and intensive care units, that really what we needed to, back to Cecilia, is work on the public health message of how do we prevent people from getting this virus. Again, it is preventable. It's not inevitable. And so I think, again, we don't have a culture of public health. We don't have a culture of prevention. And so it's not just about taking care of people who are sick, but it's having all systems aligned so that that prevention can work. And again, we're putting billions of dollars into rebuilding our public health departments. But I'm not sure we're going to do that in a way that's community focused and community grounded and informed by community needs. And so there's still a lot of work to do. Again, it's not a question of resources. It's a question of listening to community needs and voices and leadership.
Anyone want to add to that?
You might need to cut me off because I have a lot of things to say on this. But one of the things that we learned, San Francisco loses about 2 people a day to overdose. More people died from overdose than from COVID in this. And so a supervised consumption site would help to address that, would help to provide a safe place where people could go. And so I think that needs to be looked at. Mental health back then was terrible, and it's terrible now. People need to realize that housing is healthcare, and that we need to keep people housed. I mean, I don't know what's happening, but the moratoriums on evictions were lifted last week. Do we have infrastructure? What's happening? Is our systems going to be overwhelmed? What did we learn, and why did we not plan for this? So there's just a whole lot of things, but I do think, and then the other piece is that we're called long-term survivors, the age generation. Well, now you have a whole group, multiple generations of people who will be the COVID, and we'll probably have experienced the same kind of mental health, post-traumatic stress. We'll probably need some kind of care in the long term because we don't know where everything is. And to start thinking about that, what can we learn? And what is often used for us is that we didn't plan to live, we didn't do whatever. The system didn't plan, so I think the system needs to start planning now.
Anything to add, Cecilia? I know you've said a lot to this as well.
Yeah, I do. I do have a lot to say. I think that, there's a lot that we have learned from the HIV epidemic, and including, at the time UNAIDS have come up with some recommendations that includes, the solutions need to be led by the most impacted. They were calling it GPA and MIPA, which stands for greater involvement of people living with AIDS and meaningful involvement of people living with AIDS. And I think that, those are things that we can actually borrow from what we've learned to make sure that, we listen to those who have been impacted by COVID, who have been either, just recover from COVID or still fighting off, some of the conditions that come with, long-term COVID, that we can learn from them, to see like what needs to be addressed, and like what barriers there are and how to really address them. So, but most importantly, I think that things are shifting, but not as quick as we want it to be because of like bureaucratic reasons, but at least, in San Francisco, we're trying to set up like more community advisory body, to inform like public health program development. So, and you probably will hear about that very soon as well, on some of the mental health services that they're creating, like another community board that address, those who are formerly incarcerated and homeless and have mental health. So I think that we are moving toward the right direction, but the process is so slow, and and there's always like oppositions and resistance, and we'll see, but I have faith that eventually, we can overcome.
Earlier, you said you weren't optimistic, but now you have faith, and so
well, I
knew
need
there
to
was there
because like I
somewhere.
didn't want people to like go home and get all like upset because I said there's no hope.
Wait, because the last question that does touch on hope and faith and how we're all taking care of ourselves. But the question before we get there though is earlier you talked about how the community seems to be mobilizing a little faster. And throughout this entire hour, we have heard from all of you that, what's important to pay attention to is the social impact of, a pandemic. So, for example, racism as a public health issue, homophobia as a public health issue. I want to bring up that, within a year, an organization like Stop AAPI Hate was able to be created and also collect data that, again, a big shock to me that we were not collecting this kind of data beforehand, which is, these hate incidents that impact the Asian community. And so would you, talk a little bit about why this was so important, why moving at lightning speed in this way and being able to reach across and talk to one another and create organizations when these crises are happening during a pandemic is so important. We'll start with Ignatius.
So I'll say again, with the internet and our ability to access information and collect those and document those incidents of hate against Asian Americans and Pacific Islanders, I think is because we have those tools, and just as those tools can also be turned against us and fuel the hate and fuel the racism and the homophobia as well, and the transphobia now with all the legislation targeting trans people across the country. But I think for me, the takeaway is that we have to, again, take those tools into our own hands and use them in a way that uplifts, back to Vince's point, our voices, our perspectives, our experience. And people can't take that truth and can't take that experience away from us. And so that's the important part of using those tools in a way that lifts up our truths in a way that people can't deny them and take them away from us.
Cecilia?
I don't think I can add too much more to that, but I think that one of the things, this is really crucial, is that we're not the only community that are impacted, so all the Black and people of color and indigenous community have been really deeply impacted by the lack of access, to vaccines and to treatment. And I think that in order to really, for these to change, we need to build more alliances and really do some cross-movement work in order to really get to where we really want to go. Yeah, that's all I have to say.
I really feel that. And Vince?
Well, one of the things that I learned when I worked at Georgetown University was that data changes policy. So if you don't see yourself reflected in the data, you're not going to see programs, you're not going to see funding. And so if you don't see yourself included, you need to speak up. One of the things, I don't think it's an accident that they try to not collect the correct data for the census that happened recently, and it was unfortunate because COVID. But if we're not there, then we're not going to be seen. And so, I think our stories are great, and they can melt your hearts, and they can make you feel good, but the data changes policy. 80 emails and text messages to the Board of Supervisors meant one of the things that we were advocating for got raised in priority. And so if you think you can't do anything, you can text, you can email, you can make a phone call. So I think there's just, it's important.
Absolutely. And so the final question, let's leave on a positive note, and it is a question on thriving. Despite some of the horrible experiences through these pandemics, many in our community not only survived, but thrived. How did you thrive, and what brought you, or how did you find your joy? What brought you joy? How did you get to your joy? Vince, do you want to start?
Actually, I'd like to go last.
Okay, we'll let you go last. Ignatius.
So I think it's back to a theme that we've talked about, finding those allies. So I really want to echo what Cecilia said is, building those relationships across other communities, particularly other communities of color, particularly women and trans folks that so often get left out of any kind of conversations that are male dominated. And so I think for me, what gave me hope and what got me through was to continue to learn about those allies and other communities and other sectors and movements and see how to connect all those dots together. And I think that's happening again today. And that's, I think, what will get us through, but also will give us hope about a different kind of future.
Cecilia.
When I first started doing this work, I really didn't see a whole lot of trans people, whether trans men or trans women, who were doing the same work. Mostly because not everyone was lucky enough to survive. And I think that the other is, if you're struggling, to survive your day-to-day challenge, how can you learn to advocate, for larger causes? I think that has since changed. And today we see more leadership, from communities of color, from trans women who are ready to speak up, and they start leading different organizations. And I think that gives me lots of hope, because we need diversity in leadership, not just in the health system, but we also need it in promoting social change. Like I said, I think that eventually we'll get there, but I'm not sure if we'll get there during my lifetime. So I hope you can all prove me wrong.
I will try to get through this. I was told at 28 I would not live to see 30. I'm now 60. Today is also the 30-year anniversary of my partner's passing. And actually, I didn't want to do the panel today because I thought, I don't know if I want to be in public. But I'm kind of glad I did, because I think I'm the San Francisco success story when it comes to HIV. And it shows that if you give people the right tools, if they have the community, if they have the people behind them, we can thrive. And, I also lost my dad to COVID. And and all these are hard. But I'm realizing, it just is. It just is. And I feel really blessed. I have incredible friends. I have people who believe in me like Ignatius, who used to live here. I'm like, please don't nominate me for anything or ask me to do anything else. But, and Cecilia, things didn't look great for you in the 90s, but here you are today. We have so many people that we don't have the time to acknowledge, but I just feel that knowing that I'm part of this legacy. Okay, I got us up. It just, I don't know, there's just so much love that I feel, and so much gratitude and grace.
I'm going to walk on over and give you a hug, and I'm going to do that when we turn the cameras off. I want to thank all of our speakers today for all that you give our community and all the work that you do. And I'll answer the question about thrive. And, I thrive off of your work. I am alive today living an incredibly privileged life because of all that you have done. And I want you to know that community knows that. And so thank you, all of you, for all that you do. Vince Crisostomo, Ignatius Bao, and Cecilia Chung.
Thank you.
I want to thank all of you also for being here with us, both in person and online. Thank you to our partner organizations for being a part of this program. And thank you to Gilead for sponsoring this program here at the Commonwealth Club and making it possible. For more programs, please head to commonwealthclub.org/MMS. We'll see you next time.